I think it could lead to excessive morbidity and even mortality among the population in especially southeast Eugene, southwest Eugene.
Concerned reactions tonight after PeaceHealth Sacred Heart decides to close its University District Hospital beginning this November. Thanks for joining us. I'm Brandon Kamerman.
And I'm Kendall Bartley. Now, this news coming as a shock to many in the community, including officials at Lane County who received the news along with everyone else.
Now, we have team coverage tonight. I spoke with people at Lane County to discuss how the county plans to move forward following this decision. Zach Bruhl spoke with the Oregon Nurses Association, who's on the heels of negotiations with PeaceHealth regarding nurse-patient ratios.
But first, we go to Billy Spotz live in downtown Eugene at University District Hospital. Billy, you had the opportunity to speak with the interim CEO of PeaceHealth Oregon today about this decision.
That's exactly right, Kendall. Earlier today, I spoke with James McGovern. He was previously the chief medical officer with the PeaceHealth Oregon network, and he told me that this is seen as a necessary consolidation of both staff and resources within PeaceHealth's network here in Oregon. But earlier today, I was also able to speak with locals in the area to hear their concerns about not having a readily available emergency room in the Eugene area. Now, speaking with McGovern, one thing he mentioned was that a big part of this move had to do with making the PeaceHealth network more sustainable. He says those who are dealing with severe injuries and severe illnesses were already headed to Riverbend to receive care. One important piece of information is that the University District closure would only be closing the emergency room and its inpatient care centers, not the PeaceHealth Medical Group doctors' offices nearby.
University District is the emergency department. It is a small 9-bed low acuity medical unit, and inside that building, that's really about it. So those are the two primary services that we're looking to transition to Riverbend first. For those patients who are critically ill, they tend to come to Riverbend anyways. Again, this is the hospital where we do surgery, where we have labor and delivery, where we have our specialists, and those services haven't been available at University District for the last 15 years.
While PeaceHealth has its reasons for the closure, some people living in the area are worried about the potential impact it could have on students at the University of Oregon nearby.
I just think, considering that the vast majority of students live over on this side of campus, and the vast majority of, I'd say, incidents that would happen on any given weekend are over here, it's just kind of irresponsible to not have an emergency room over here.
Now, Erickson said that he and many friends have needed the University District services over the years, and he's worried that the closure could leave many students in a rough spot if they need medical help. Now, I was also able to talk to McGovern about employees at the University District. He said many have been given the opportunity to transfer to Riverbend if they so choose, and he's hoping to see about a 50% retention rate in that time period.
All right, thank you, Billy. And today, KVAL sat down with one of those employees.
Now, Zach, you spoke with the Oregon Nurses Association today. How are they reacting to the hospital's closing?
Well, Kendall, I met with Kevin Paul, who's not only on the ONA executive board, she's also a 24-year veteran emergency department nurse at that hospital at University District. She tells me the ONA board was surprised with the timing of this announcement. Negotiations with PeaceHealth on a new labor agreement just concluded days before the announcement. She says during those months of negotiations, the idea of closing the hospital didn't come up in discussions. The crux of their negotiations were patient ratios, how many patients a single nurse is responsible for at a given time. This change will potentially provide more nurses at those other hospitals, Riverbend and McKenzie-Willamette, but Paul worries there could still be a negative impact on patient ratios.
Would you dispel any idea that this is going to improve ratios?
Yes, that's absolutely right. I don't see that happening because there are some people who are taking positions elsewhere. Some people don't know what they're going to do yet.
That another concern is what will happen to patients experiencing mental health crises from Eugene. Paul says the University District Hospital has 12 secure rooms that are designed for those sorts of patients. She says Riverbend currently doesn't have any rooms like that.
Riverbend has nothing like that. They have 2 rooms that are open to the hallway. They're not secured. They are lockable, but they're not secured, and so it's just a very different setup, and we're very concerned about what's going to happen with these people.
Now, to be clear, PeaceHealth did say in yesterday's announcement that they're planning to invest in more secure spaces for people having mental health challenges in their other emergency department at Riverbend. ONA tells me they are still holding out hope that there can be change here, whether that's in a delay for this proposed closure or that a regulatory agency at the state level will step in.
Either way, a lot of people impacted. Lane County Commissioner Laurie Trieger made an impassioned speech in yesterday's board meeting shortly after news broke of PeaceHealth closing the University District Hospital. She spoke of the closure's negative impacts on those in West Eugene facing emergency situations like the unhoused community, students at UO, and the fact it will ultimately cost people jobs. We followed up with Commissioner Trieger today, and she reiterated that concern.
So I fully appreciate that PeaceHealth has a business model problem. But the fallout of the way they're choosing to solve that is less access to health care, and we will have poorer health outcomes in our community as a result of it.
Vice Chair Trieger made the point to say she wasn't speaking on behalf of the county or board, which doesn't actually have oversight of PeaceHealth and isn't making any immediate policy decisions since the news is so fresh, but she did feel for her constituents that will be impacted. Again, Lane County does not have oversight of the hospital. The county doesn't make decisions about where to place emergency services, but the public health department will immediately work to analyze the impact the hospital's closure will have, and people in the community will work to address the challenges it creates.
I think the main message to our community is that we're not going to sit back and twiddle our thumbs and hope someone figures out. We're going to be, at the forefront of that conversation, liaisoning and collaborating with our partners in the community to make sure that a solution is arrived at quicker and sooner rather than later.
Now, Davis said concerns valid about what the University District closure will mean, say, if there's a major catastrophe like an earthquake or mass casualty event.
That concern is valid and real and justified. And I would say that there's a lot of thought that goes into that. The placement of a healthcare center it has to be very strategic. It has to be accessible.
The regulatory board that will oversee the closure is the Oregon Health Authority, which informed us it has not yet received notification of a planned complete closure. We also reached out to the city of Eugene. We were told Mayor Lucy Vinnis is unavailable this week, but we will continue to follow up to see if the city plans to address the fact that it will no longer have a hospital.